Hello and welcome to Homeopathy Simply Explained. I am Petra Merker, an alternative practitioner for classical homeopathy in Darmstadt, and in today's video we have the seminar on the topic of pandemic, again with the fourth part, the transition from a COVID infection to long COVID. Some people have hardly any symptoms with a corona infection and are even asymptomatic. Other people, on the other hand, are completely overwhelmed and some never recover from the illness at all. COVID then becomes chronic. The clinical picture then differs from those who only have a normal infection, which quickly disappear. We have seen such cases in the last two videos. Homeopathic treatment is also different from normal acute cases. I treated all the cases that I have shown you so far with individual homeopathic remedies, just as we learned from Hahnemann and Kent. For patients who are developing or have developed a chronic corona infection, I haven't gotten very far with the usual individual medication prescription. Due to my daughter's illness with ME/CFS, the most severe form from long COVID, I have dealt intensively with the topic and, for the first time in my homeopathic career, have used several homeopathic medicines at once based on my findings in order to have a positive influence on such cases. In today's video, I introduce you to a patient who was about to develop a chronic infection, means long COVID. First of all, as always, let's take a quick overview of what awaits you in today's seminar. Topics of the fourth part. First, study on neuropsychiatric complications after a COVID-19 infection. Second, what happens with a traumatic brain injury. Third, the case, transition post-COVID to long COVID. Fourth, discussion of the homeopathic medicines used. Fifth, neuropathological mechanism of COVID infections. Now I hope you enjoy the seminar. On September 26, 2024, the German Medical Journal reported on a study about neuropsychiatric complications after a COVID-19 infection in patients who had a severe infection and had to be hospitalized as a result. This study confirms what I have long suspected about ME/CFS patients and am adjusting the homeopathic treatment accordingly. On the one hand, laboratory markers were used to find brain damage, which was related to the cognitive disorders, and on the other hand, the cognitive limitations in some patients were related to the symptoms of post-traumatic stress disorder, such as can arise from a head injury or an accident. Laboratory markers that can make this visible are on the one hand an increase in neurofilament light chain, NFL for short, which indicates the axonal damage to the nerve cell, and the glial fibrillary acidic protein, GFAP for short, which makes the damage to the glial cells visible. If the brain is damaged in this way, the cognitive limitations correspond to, I quote, premature again of the brain by 20 years, end of quote. Of course, the results of this study does not apply to all post-COVID patients, but only to those who had a severe course with neuropathic complications. The test for NFL can be carried out in a laboratory in Berlin. I link you to an information brochure about this investigation under the video. A head injury before infection with corona can play a major role in some people. I found a wonderful site on the internet where Dr. Wolf explains how a head injury can affect you. A concussion can cause bruising and tears in brain tissues and blood vessels. The severity of the impaired concussions divides the concussion into 3 stages. Since the impact causes a pressure wave to rush through the brain, the wave is often relieved through the optical hole and therefore has to pass through the brain stem. So-called brainstem symptoms can occur, which can be accompanied by movement and speech disorders. Axons means nerve processes are also stretched by the pressure wave, which leads to action potentials. The messenger substance glutamate is released and there is an outflow of potassium from the nerve processes. In order to restore balance, the ion pumps in the cell wall must perform at peak performance. In order for them to work at full speed, the ion pumps needs energy in form of ATP, which is produced by the mitochondria. The production of ATP produces lactate, which in turn causes an influx of calcium into the cell and damages the mitochondria. ATP production is reduced again due to this damage. The result of this cascade is programmed cell death. The cells die and the blood-brain barrier develops holes so that pathogens or toxins can penetrate the brain more easily in the event of an infection. Of course, the body tries to patch these holes, but that doesn't make the whole story any better. The repair mechanism leads to Alzheimer-like deposits. If the brain is repeatedly hit, inflammation and repair mechanism will occur again and again, causing scar tissue to form. Long COVID counts both the long-term symptoms of a corona infection and those after a corona vaccination. The symptoms are similar in some cases, but are not the same in homeopathic treatment. In the case of long COVID caused by a corona infection, there is a transitional stage in which, in my experience, the disease can still be treated homeopathically. I would like to introduce you to such a transitional case today. This is a patient I have been treating for several years. I discuss the medicines used in detail because these can also be important for long COVID or ME/CFS illness, as we will see in other parts of the seminar. The patient had already had her 4th corona infection. The last corona infection was accompanied by heart palpitations, and that is something we have already seen in other post-COVID cases. The racing heart seems to be an indicator that the pathogen has infected the nervous system. Other complaints included a sore throat, buttocks, and pelvic pain. From September 13, 2024 to September 18, 2024, the patient was ill in bed. When she was free of symptoms, she went back to work. During the night of September 23, 2024, the patient slept poorly and felt flu again. She was overcome by leaden fatigue and everything hurt. Hot flashes occurred and she became irritable. Noises worsened her condition. There was wave-like bone pain that radiated into the joints. Nerve pain was noticeable all over the body and also on the skin, which was made worse by cold and bad news. The patient had a sore feeling in the back of her head when she leaned her head. When asked, the patient reported that as a child she hit the back of her head on a tiled floor during a sports exercise. Do you remember my daughter who had exactly the same symptoms? At first she had heart palpitations, and then all of a sudden in Greece her old head injury started hurting again. Alarm bells rang for me when I heard this. In such cases we have to be very attentive and inquire about the complaints carefully. But back to the patient's complaints. Warmth was good for the patient. She sweated on her back and the hot flashes extended upwards. The patient became dizzy while standing. When she sat, she had to raise her legs and she was only able to walk upstairs with a lot of breaks. When the acute corona infection was still present, there was stabbing pain in the chest when coughing, and the patient has greenish discharge from her nose. The back was sore and the patient had an aversion to her children. Despite her condition, she tried to rub away every little spot she saw, which took a lot of effort. Before she became ill, she had to study a lot for an exam and was personally disappointed by her boss, which really bothered her. Let's now look at the repertorization. We have the symptoms improved by heart and the recurring complaints. The emotional symptoms are also very pronounced, with irritability, discomfort due to disappointment, and emotional excitement. With this section, I have covered the nerve pain caused by being frightened. I have covered the nerve pain caused by terrible events, such as an injury to her son in the terrible and sad stories section. That affects her greatly. I have covered the strange symptom of pain in the back of the head in the head pain in back of the head section. Here you actually have to go to the general section about pain in old wounds. This section does not contain the many medicines, but we should keep an eye on this section in such cases. Here we see, among other things, the drug Nux vomica. Since the patient is currently overwhelmed both psychological and nervously, this medicine can still be helpful to us. We almost always see these complaints of overwhelm in long COVID cases. The next section I have is the sweat on my back, the rising hot flashes, the worsening from standing, and the stabbing chest pain from a week ago. In homeopathy, we always look at the development of an illness from start to finish and use prominent symptoms from the beginning of an illness to find medicine. As a patient, it therefore makes sense to write down your symptoms right from the start so that you can report them to your doctor a week or even longer later. The next categories are the greenish nasal secretions, the painful kidneys, although we don't know exactly whether it is the kidneys that caused me to have the back. And the striking psychological symptoms are the dislike of her children and the fact that she is very perfectionist, which is also reflected in her exam preparation, has shown. Here we see the drug picture sepia followed by Nux vomica, which we keep an eye on. I gave the patient sepia XM and her energy level increased. Since the disease was getting ready to settle in the body, I prescribed a homeopathic medicine on a constitutional level, sepia XM, 1 globally 4 till 5 times a day. In sepia, we find memory impairment with ponderous thoughts. The patient can hardly think and is incapable of mental work. The language can also be very slow. To express yourself, the words are drawn out. The patients are different, have no feeling for life, and feel very tired. There is also sensitivity to sounds, light, and touch at the hair roots. Everything involves a lot of effort, and the patients are absent-minded. The circulation and heart are weak, and there is a risk of a stroke. Dizziness attacks can also occur. Headaches come in terrible shocks or feel like a concussion. Sepia is a medicine for patients whose nervous system is chronically affected. The sympathetic nervous system is excited. The causes of the symptoms are overtiredness, fear, anger, and overwork. Due to the heavy upper eyelids, the eyes cannot be opened. We can also be dealing with chronic meningitis in which the patients are apathetic and have a severely reduced vitality. Sepia acts on the hormonal system, has venous stasis, and may have a tuberculin miasm. One day after taking sepia, the patient felt significantly better in terms of energy. However, after an argument in the family, she had the feeling that she would collapse at any moment. There was a headache and a tightening feeling in the chest. She was overwhelmed by everything, but was able to move smoothly through the apartment again for the first time. Because she was overwhelmed, I prescribed another homeopathic medicine, Nux vomica M, twice a day. With Nux vomica, we have hypersensitivity to sensory impressions such as light, noise, smells, or even touch. The patients are overwhelmed by everything. Everything is too much for them. The third cranial nerve may be paralyzed, and patients may suffer from loss of vision or loss of hearing. Brain fatigue makes patients feel dizzy, similar to after a night of drinking or drinking alcohol. You are sleepy all day or suddenly fall asleep and fall to the floor. After a psychological shock, patients may develop a fear of being alone. There may be a feeling of fainting, like dizziness when standing up or lifting your head. Patients experience worsening through night waking, mental overstrain, smells, etc. Headaches can feel sore in the bones, like a bruise. We remember that patient's old head injury which suddenly started to hurt again. The scalp is sensitive to touch. With this medicine, we are also dealing with a disorder of the sympathetic nervous system. Spinal cord irritation can lead to convulsion that can be triggered by touch, movement, or noise. The chewing muscles may be painful or stiff, and lockjaw may occur. Another day later, the patient reported that the hangover feeling was almost gone, but there was still a buzzing in my head. It flickered, vibrated, and she felt like she was in a crackling sweat. The feeling that she was about to collapse had improved by 90%, just 1 hour after taking Nux vomica. When she turns her head, she feels like her brain is coming in a wave. There was still extreme tiredness, so much that her eyes closed during the day. However, the patient cannot sleep during the day due to inner restlessness. These symptoms show that the sympathetic nervous system is too active and the body is in a state of shock, because the spike protein destroys cells in the body, which probably put it in a kind of state of shock. I prescribed the patient aconitum XM once a day. If you want and haven't done so yet, you can pause the video at this point and watch my theory regarding the disease ME/CFS and subacute distributive shock. This theory forms one of the foundations of my treatment of ME/CFS and long COVID, but also post-vac patients. I link you to the video under this seminar part. Let's now take a closer look at the two biggest shock agents that I use for these patients. Aconite patients have a strong heart and a lively spirit. There are congestions to the brain. Patients experience deterioration due to a cold winter, summer heat, fear and noise. The excitement affects the heart and brain. On a psychological level, we find nervousness, restlessness, irritability, fear, excitement, delirium, fear of death, and anger. The entire sensorium is in turmoil. The nerves are hypersensitive and the patient has a hot face. If the organism is confronted with a shock, the nervous and vascular system becomes hyperexcitable. There is a sudden contraction or expansion of the vessels with tremors, restlessness, or exhaustion. Extreme cold or bad news can also cause such a condition. We remember that our patient suffered from worsening nerve pain due to bad news. The patient may be afraid of being in small spaces with many people, of a stroke or of heart diseases. Opium is another great homeopathic medicine that can be used in shock. With opium, we are dealing with the consequences of shock. If the shock has not been overcome or the memory of it continues or comes to mind again. Patients who need the homeopathic medicine opium cannot consciously perceive their surroundings. All sensory sensations are disturbed. Here too, there can be restlessness and nervous excitement. Patients are sleepy, anxious, and sensitive to noise. There is a sluggish reaction and partial paralysis can also occur. There may be a weakness in the abdominal muscles so that the abdominal pressure does not work when defecating, or a weakness in the esophagus that hinders swallowing, but weakness and paralysis of the muscles in the arms and legs are also included in the drug picture of opium. Some patients cannot move or even blink their eyes. They cannot get out of bed. The slightest cracking of a door or ticking of a clock is unbearable. There may also be sensitivity to noise, smells, and light. Patients are sleepless but numb. There may also be a lack of pain. Opium, the consequential damage occurs through a traumatic brain injury or another shock. It affects the central nervous system, the sympathetic nervous system, blood circulation, and smooth muscles. Paralysis of the sphincter muscles can also occur. Patients lie with their eyes half open, drowsy but unable to sleep. A central artery embolism can also occur. The whole organism is sluggish with reduced voluntary muscle activity. The brain functions are paralyzed. Opium can also be used for post-traumatic stress reactions when shock cannot be overcome and patients have flashbacks. With opium, we also have to think of birth shock if the patient had a difficult birth as a baby. Anesthesia also represents a shock to the circulatory system. A day later, the patient's heart palpitations and empty feeling only occurred in phases. The patient no longer lost as much energy through physical exertion. The eyes were still heavy but no longer had to be closed during the day. The patient also no longer had to lie in a darkened room. However, the lean heaviness of the body was still there, but the patient was able to write emails again. The old injury to the back of the head no longer caused any problems, and the bruising in the head was no longer there. When the patient was overwhelmed, sensory overload still occurred. Showering and bathing was still very tiring for her. After a night, the patient was psychologically more confident again. Another 2 days later, the patient was feeling well again. Let's take a quick look again at what exactly happens when the central nervous system is injured by a COVID infection. As we already heard in a previous seminar part, the virus binds to ACE2 receptors to get into the cell. Activation of this receptor results in an increase in nitric oxide, which can damage mitochondria and lysosomes. Protein damage can also occur, and hyperphosphorylation of tau proteins in the axons can cause neurodegeneration, similar to that in Alzheimer patients. In addition, the blood-brain barrier can be disturbed, resulting in hypercoagulation and microbleeds. In deceased patients, it has been shown that other pathogens such as chlamydia, helicobacter, borrelia, and herpes virus also promote neurodegenerative diseases. As we have just heard, a COVID infection can lead to hyperphosphorylation of the tau proteins in the axons of the nerve cells. For this reason, I also used the greatest homeopathic nerve remedy as Schüssler salt, potassium phosphoricum in potency D3 to D12 for most patients. In patients who need the homeopathic medicine potassium phosphoricum, the nerve center and spinal cord are affected. Here too, we are dealing with a disorder of the sympathetic nervous system. There is a great fear of noise. Confusion is also part of the homeopathic medicine picture of potassium phosphoricum. The optic nerves may be exhausted, and a loss of strength in the facial muscles may occur due to twisting of the lips. Some patients want to eat something every hour to replenish their energy levels. There is great tiredness and exhaustion. The blood circulation is also affected by this debilitation, so that a collapse can occur. The spinal cord is softened and paralysis can occur due to nerve exhaustion. The brain cells are very sluggish in their function. The causes of illness in potassium phosphoricum are excitement, overwork, or worries. This was the only way I could help the patient presented preventatively. Since the disease affects the entire system and affects it at different levels, it is very complex. The more advanced the disease, the more complex the homeopathic treatment becomes, which we will look at using case studies in other parts of the seminar. So with this patient, I treated on 3 levels. First, constitutional with sepia, Second, the nervous system with the overload with nux vomica. And third, the shock symptoms with aconite. The conclusion I was able to draw from this case was that early homeopathic treatment can prevent the transition from an acute illness to a chronic illness. You are welcome to support my work. You can find my PayPal account linked under the video. If you enjoyed the seminar, I would be happy about a thumbs up or a subscription. I look forward to seeing you again next time. Until then, bye.